What effect will the Affordable Care Act have on the future of nursing education? The Affordable Care Act, or ACA, is not only expanding access to health insurance coverage, but also increasing employment and educational opportunities for nurses. The ACA has made important new decisions to expand access to primary and preventive care in underserved communities. With this comes the need for more nurses. As more people gain access to health insurance coverage, the demand for primary care services at health centers increases. The ACA calls for routine care to be provided in outpatient or ambulatory settings. Additional funding has been allocated to increase the quality of preventive care and routine well health exams for the general population. This type of care will be nurse-centered and include the following: community health centers, National Health Service Corps, school-based health centers, nurse-managed health clinics, and new opportunities will be available for nurses such as care coordinators, faculty team leaders, informatics specialists, nurse family cooperative facilitators, and even primary care providers. The ACA will likely change how and where we see patients. The ACA will improve access to care, but it could mean increased workloads and stress for hospital nurses. Some argue that the ACA will negatively impact the nursing shortage by increasing the demand on nurses as more people will have health insurance. Nurses must advocate for safe staffing ratios to protect themselves. Due to decreases in reimbursements from patients who can't afford co-payments and deductibles, hospitals could cut staff and see a decrease in quality of care. When asked, what effect do you see the Affordable Care Act having on the future of nursing, a public school BSN nurse states, "I predict hospital nurses will begin to look for employment outside of the hospital setting. The ACA stresses the importance of health education and disease prevention, and nurses will begin to see positions open in the community along the lines of home care, outpatient care, clinic care coordinators, and transitional care coordinators. There will be a competition for jobs such as these, and to stay competitive in the field, nurses will need to obtain higher levels of education. Ideal candidates will need to have at least a BSN or greater, no matter how many years of experience they have under their belt." In her article entitled "The Affordable Care Act: What It Means for the Future of Nursing," Brenda Cleary, PhD, states that what many Americans do not know, including many nurses, is that nearly one-half of the 926-page healthcare reform law authorizes healthcare delivery models, addresses a variety of healthcare workforce issues, and provides authorization for many new educational training programs for nurses and other healthcare professionals. She believes there will be a shortage of over 300,000 nurses by 2020. The ACA takes into account the aging of the baby boomer generation, and it includes provisions to provide care for this population. Cleary writes that the new care delivery models provide opportunities for nurses, but are predicted upon having a more highly educated nursing workforce. The ACA also has numerous nursing education provisions. She also states that the new care delivery models in the ACA have implications for the educational preparation of the nursing workforce. The growing expectations of registered nurses will require a substantive increase in nurses with baccalaureate and higher degrees, including PhDs and DNPs, and advanced practice registered nurses in primary care. The ACA made additional investments in nurse education programs. More than $1 billion has been allocated to educate new nurses and prepare them to deliver health care in redesigned healthcare settings. The ACA directed $15 million to nurse-managed health clinics, managed by advanced practice nurses and affiliated with schools of nursing. These clinics train new nurses while delivering primary care to vulnerable populations. The ACA also directed $31 million to prepare more primary care advanced nurses and $200 million for graduate nurse education programs that prepare APRNs for roles in coordinating care. Included in the ACA are the Nursing Student Loan Program, Nurse Loan Repayment and Scholarship Programs, Nurse Faculty Loan Program, Nurse Education Practice and Retention, Mandatory Funding Stream for Title VIII programs, Public Health Workforce, Allied Health Workforce, and Nursing Workforce Diversity Grants. There is a renewed focus on wellness, health promotion, disease prevention, disease management, while also focusing on organizational performance, health outcomes, and payment and cost factors. However, there are already insufficient numbers of instructors, limited clinical sites, and budgetary constraints, which contribute to the rejection of qualified applicants to nursing schools. According to Amy Anderson, DNP, in 2012, nearly 79,000 qualified applicants were turned away from nursing programs. Making matters worse, the average salary for positions in nursing education is significantly lower than what these experts can earn outside academia, making it difficult to recruit and retain key academic personnel.